Thanks, Angela. If anyone in the audience has a longer title than I do, please let me know. You know, as Pete said, the U of M students are the lifeblood of the entrepreneurship ecosystem. And I have the pleasure of introducing two of those today, Parisa and Brianna. And they're a great example of two students that have really leveraged the U of M ecosystem. They got their start in the School of Public Health Innovation and Action Program, and they participated in the Campus of the Future, which will actually have a presentation on October 26th, and you'll hear more about that later. But where I met them was in the U of M Student Accelerator Tech Arb. I was immediately impressed by how quickly they could go from concept to pilots with paying customers. It was really unbelievable. And it really speaks to their passion and skill, but it also really speaks to the seriousness of the problem that they're addressing. I don't think anyone in the audience would be surprised if I said our healthcare system is in crisis. We really cannot handle the tsunami of chronic illness through the systems we have today. And I believe that facilitated patient networks, like the one Find Your Ditto is doing, is really the way that these patients are going to be cared for in the future. But really, that's Find Your Ditto story and Brianna's story. So, Brianna, why don't you come on up and tell your story.
Just call on me, brother, when you need a hand. We all need somebody to lean on.
Good afternoon, everyone. Thank you all for being here. My name is Brianna Wolin. I'm the CEO and co-founder of Find Your Ditto. Over 1/2 of all U.S. adults live with a chronic condition, whether it's diabetes, depression, cancer, Crohn's, or dozens more. And I'm one of those people. I've been living with type 1 diabetes since I was 4 years old. And this is a photo of me when I was a student at the university. As you can tell, I was very excited to cheer on the Wolverines with my pom-poms in hand. But what you don't see in this photo is the 3 separate security guards I was dragged to have my fanny pack approved despite the no bag rule in the stadium, because I needed to carry my supplies in case of a diabetic emergency. And I was pulled away from the people I went to the game with, and I was in a sea of 40,000 students at the university, and yet I felt so incredibly alone. And as someone living with type 1 diabetes, I make over 180 health-related decisions a day. 180 each and every day. And the toll that making those decisions really has is resulting in something called illness distress, which essentially means that having to make all of these decisions on my own and weighing on who I am can amplify my symptoms, can lead to a sedentary and poor lifestyle, and ultimately can decrease medication adherence. All of these things poor for our healthcare system and for my own health. But what we do know is that people living with a chronic condition are able to lead longer and healthier lives if they have a peer support network. Now, many of you probably have heard from the American Heart Association that you should go out and go for a run, keep moving, walk. That's going to extend your life. And some of you may have set an alarm for 5:15 in the morning to go for that run before work, but when that alarm went off, many of you probably hit that snooze button. But if you had a running buddy waiting outside your door, just so that it would get you up in the morning, it's much more likely that you probably went on that run making that positive health-related decision. We know that peer support is powerful, and that's why people have been trying to do it for a very long time. Started with physicians, but they're constrained by HIPAA, meaning that even if there are 2 patients in rooms right next door to each other asking to meet another patient with the same condition, physicians can't do anything. So hospitals said, okay, well, let me set up a support group, but that has a constrained day, time, location, and topic that's put on by an educator rather than the peers themselves. So patients said, okay, I've had enough of this. I'm going to go online. I'm going to connect with people on Twitter and Facebook and find someone across the globe that they could talk to and share an experience with. But it's missing that key element, that face-to-face interaction that is so crucial in reducing that illness distress. It's a complex, antiquated, and impersonal system. So that's why we've created Find Your Ditto. Find Your Ditto is a mobile application that connects people with the same chronic illness in the same community for on-demand, in-person peer support opportunities. Our product is easy to use, providing that in-person, informal experience that is on demand and based on those personalized match opportunities that are so crucial to a positive outcome from your peer support. We're part of a market that's about $5 billion related to all of the data surrounding patient behavior outside of that clinical office. But we're going to begin with diabetes. And from there, once we've established market share and done a successful launch and rollout with that condition, we're going to move into IBD and chronic pain, which allow us in total to capture over half of the market with 3 categories of conditions. And the way we're going to do that is with pharmaceutical company regional sponsorships. And why, you might ask? Well, these pharmaceutical companies have a unique opportunity in the way that they're accessing thousands of patients across the country using their drugs every single day, yet they don't really have an opportunity to promote that brand loyalty and positive patient outcomes that reflect well back on the company. So by providing Find Your Ditto as a sales tool for their force, they're able to promote that brand loyalty and also improve patient outcomes by providing that 360-degree patient view when patients are receiving peer support as part of the management of their chronic condition. As I mentioned, our business model then in the first 2 years is related to those sponsorships, where we're going to be assessing per condition and per state. But what we really know is that there's a changing state of healthcare that's getting away from reimbursement based on volume and actually moving into caring about outcomes. And the impact of patient behavior is having extraordinary impact on actuarial models because people care about what those outcomes are in order to be reimbursed. So we're going to kick in our data sale model at years 3 and beyond on that same per state and per department basis. And with our sponsorship, we know that we were going to get about $15 million in the market by year 5. However, once we kick in that data sale, we project that our revenue is going to reach $75 million in the next 5 years based on this changing state of healthcare. Patients have several options, as I mentioned before, whether it's meeting in a support group or online, but nothing provides patients with the experience that we are in that in-person, informal setting. And when it comes to sponsor options and how they can promote that brand loyalty, they're doing things like bringing lunches for the doctors or leaving coupons for the patients. But nothing provides a mobile and interactive solution that's surrounded on patient outcomes that would promote the loyalty to the brand like Find Your Ditto does. To date, we've raised $60,000. In addition, have paying customers with the Detroit Medical Center going up for a paid clinical trial next year. And we're in our final discussions for our phase sponsorship by an international diabetes pharmaceutical company. We've additionally been featured and recognized in national and international media outlets. And this has all been done by our founding team. Myself, as I mentioned, I've been living for almost 2 decades with chronic illness, giving me a unique perspective that ultimately allowed me to win an International Patient Entrepreneur Award in 2016. And my co-founder and our Chief Product Officer, Parisa Saraya, has extensive experience in healthcare and health initiative implementation and has particular interest in chronic disease management and has received her master's in health informatics to push us along as we do. We have a great team of advisors that have advised us on everything from clinical partnerships to pharmaceutical sales and modeling, and ultimately those healthcare and compliance concerns that a lot of our customers have. Our current needs are pharmaceutical company connections so we can get more sponsorships up and running, and additionally lead software developer referrals so we can bring everything in-house from here going forward. If you remember the story I told you at the beginning about my experience as a University of Michigan student, I want to return to that for a second. And I want to really, bring it back around to the fact that my experience is not unique. It was not just as a student. And we were able to launch a low-tech pilot at the university last year. And in the first week of opening up registration, another female student with my same conditions registered to meet her ditto. And even though I went 4 years without meeting someone who could really empathize with what it was like to live with my condition, my ditto, all it took was mobilizing a platform like Find Your Ditto to really initiate that connection. So we're creating a world where no person living with chronic illness ever has to feel alone. And I want to thank Desai for this incredible opportunity to be here and build our business on behalf of our female-founded team. And I would welcome all questions and discussion out in the lobby afterwards. Thank you so much.
and I got them too.